Welcome, dear students. Myself, Dr. JSMLT, again with you, this time with the next part of mucoadhesive drug release systems. In our last lecture, we discussed the concept of mucoadhesive drug delivery, the factors affecting the mucoadhesion. We discussed them in detail. Now, this is the time to go for the further details on the preparation and characterization part and the application part. Let's open up our discussion on the mucoadhesive drug release systems. Uh, Dear students, after completing this lecture, you will be able to classify, prepare, and characterize the mucoadhesive drug delivery systems and enumerate the applications of mucoadhesive drug delivery systems. We will be covering this lecture under the heads classification of mucoadhesive drug delivery system, preparation, characterization, and their applications. We can classify mucoadhesive drug delivery system number one based on types of delivery system, number two based on routes of administration or the physiological considerations. Now let's see the classification of MDDs. Okay, as you can see here that they may be either solid, semi-solid, or liquid bioadhesive formulation or mucoadhesive formulation. Okay, so solids may be subdivided into tablet, inserts, lozenges, and microspheres. By this semi-solid may be gels, films. Okay, and the liquid may be the viscous liquids, gel forming liquids. So we can classify them depending upon the states. Next, we can classify them on the basis of routes of this administration. It may be either from oral, vaginal, rectal, nasal, ocular. These are the major routes of administration through which the mucoadhesive drug delivery may be done. Among the within the oral, there are buccal, sublingual, and gingival subcategories are there for the mucoadhesive drug delivery systems. Now, what are the merits of oral mucosal delivery? Easy accessibility is there, easy administration or removal of mucoadhesive drug system from the sites of application we can have. Most accepted routes of administration it is. Hence, there is a good patient acceptance and compliance. It is robust in tolerating the variety of materials or drugs. The oral mucosal delivery is less prone to irreversible irritation or damage by a dosage form or the component thereof. There is the ability to recover after the local treatment. There is not much issue. As per the limitations are concerned, drugs which irritate the oral mucosa cannot be given by this route. Number one, drugs which are unstable in buccal pH cannot be, or oral pH or oral environment cannot be administered by this route. Only the drugs, only the drugs with a small dose requirement can be administered. I think up to 100 mg only we prepare for the mucoadhesive drug system if the dose is less than 100 mg. Okay, patient non-compliance sometimes because the dislodging may be there, so sometimes the patient non-compliance is issue for the limitations. Now let's see the oral mucosa. Oral mucosa has got the various peculiar features like high vasculature. High vasculature, there are lot many, blood perfusion is very good. Okay, as you can see in the sublingual area, in the buccal mucosa, we can use it for the local as well as the systemic action for oral mucosa. The quick onset of action, as you might have seen in the emergency conditions, nitroglycerins are, nitroglycerin capsules are sublingual capsules are given. Okay. Quick action is there. Subclassified into sublingual, buccal, and gingival mucoadhesive drug system. The mucosa is divided into epithelium, basal lamina, and corrective tissue. Okay, while the uh, mucosa is essentially same in this structure. Three layers you will find everywhere. It is essentially same in structure with same regional variation with the some regional variations, you can say, in structure, keratinization of epithelium, thickness, and blood flow. So some regional variations may be there. As we can see in this table, just see this table, that in the buccal mucosa, surface area of buccal mucosa is 50.2 centimeter square with the thickness 500 to 600 micron, and a medium vasculature is there, while the sublingual has the highest vasculature is there, but the area is less, the thickness is less here. Okay, mucosal thickness is less. In the case of gingival, the 200 micron to 250 micron thickness is there. Okay, and again its medium vasculature is there. So we can say, depending on the vasculature, thickness, surface area, they may vary, but essentially the three layers are always there: epithelium, basal lamina, and connective tissue. And epithelium is subdivided into mucus, stratum distendum, stratum filamentous, stratum uh, suprabasale, and stratum basale. So if we are going for design and development of oral mucosal delivery system, now what is the basic concept? We must consider the environmental factors, drug factors, and polymer related factors when we are trying to develop a design of the mucoadhesive drug delivery system. We must select a proper drug and a proper polymer, their compatibility with each other and their compatibility with the microenvironment to which they are going to expose. Selective proper delivery system, selective proper delivery, I can say you must select the proper delivery system. Okay, either you are going for the buccal tablet, or you going for the that gel, or you going for the film. So select it rationally. Ensure the residence time and biodescent. You must ensure that what is the required residence time and how you can give it with the help of the polymers. So these mucoadhesive drug system needs the prior planning and designing with respect to these factors utmost essentially. For gingival patch, examples are the buprenorphine and melatonin, or the gel you can plan. For sublingual delivery of tablets, mucoadhesive tablets like nitroglycerin, isosorbide dinitrate, erythritol trinitrate, nifedipine, buprenorphine, this apomorphine, for spray, isosorbide dinitrate can be designed. So dosage form selection is depending on the drug also, their biological half-life, their nature. Okay. For buccal delivery of tablets, like in case of buccal delivery of tablets, prochlorperazine, oxazepam, lorazepam, methyl testosterone, gels and chewing gum of nicotine, they are, by this way, these are the examples how we are selecting a particular delivery system for a particular drug. So you must remember some examples to support your discussion. Methods of preparation, as we know, we have discussed almost all node systems. So whether you are preparing a film, you will prepare in the same manner as you prepare the transdermal films. Okay, more just the polymers you will have to take with cautiously, that you will have to take the mucoadhesive polymers. Same is in the case of tablets. The selection of polymer is important here. In the case of gel, spray, so you just have to ensure the compatibility with the microenvironment with respect to the pH, with respect to the mucoadhesion, and with respect to the drug release. Okay, so the three concepts you have to take into consideration, and then you can plan any delivery system. Okay. As far as the characterization methods are concerned, before, let me give you some insight that what we can do in the preparation methods, that if a film is there, if you are preparing a film is there, if you are preparing the polymer selection is very crucial. So you must address the polymer selection. Polymer selection is very important because as we have discussed, the mucoadhesive polymers have the unique properties. So you will have to select the mucoadhesive polymer grade. Okay, and in the laboratory purposes, you must address the adhesive that adhesive concentration, and you must also address the plasticity of the film in the case of films. So depending on the delivery system, uh, the things which are required for ensuring the residence must be focused. Now let us focus on the characterization methods. Now that too specific one. Why have we have mentioned specific? because we have mentioned here specific thing. Why specific? Because all the characterization parameters which are generally for a film, which are generally for a tablet, will be there obviously. Just you will have to just we are focusing here what are the mucoadhesive characterization, what is needed especially for ensuring the bioadhesion properties of the delivery system. So apart from all other methods for a particular delivery system like drug content, loading, thickness, surface morphology, what are the things like swelling studies? It must be done. We will be discussing it. In vitro biodescent test with the help of text analyzer, modified balance surface tensiometer, etc. There are so many techniques. Surface morphology, however, it is a common technique, you can say. It's not a specific one. But yes, in the case of it needs specific attention. That's why we have categorized this here. It needs specific attention that what is the surface, just is a change in the surface morphology in case of hydration, maybe. You can see it. So, unlike the other things, you see the effect before and after of the hydration of a particular or before and after the swelling, let's say. In vitro permeability and in vivo studies. Okay. So, let's move one by one. In vitro swelling study. Swelling is a prerequisite because the delivery system, that matrix needs to be swollen. It swells first when it becomes uh, in intimate contact it is with the biological fluid or oral mucosal fluid or whatever with the mucosal fluid you can say. It absorbs that fluid and swells. That swelling is the prime requirement. Until the swelling is there, the polymer chain will not unfold and they will not be ready for the entanglement and the consolidation state will not occur. So contact may be there, but consolidation depends on swelling. So agar plate method, develop the agar plate, okay, and if the microspheres are there, we can put the certain number of microspheres you can say, and you can characterize the percent them by the percent swelling or swelling index, or you can see the increased weight, length or dia. If you are preparing, if you are observing for the tablet, you can see the increase in diameter. In case of film, you can see either the weight increase or the length increase, or okay, or any this increase must be noted for the delivery system, and this can be indicated. This may be taken as an indicator of the swelling property, and this swelling property must be good enough to lead to the consolidation stage of the mucoadhesion and bioadhesion, because we know without the consolidation stage, the contact or just the contact will not serve our purpose. The drug must need to pass across that mucosa. For that, consolidation and entanglement of the polymer chain with the mucus is must. Now moving to the in vitro biodescent test. What is this? The measurement of the force of detachment and the total work of adhesion. Total work of adhesion. This work of adhesion is very important, word. The total work of adhesion which results from area under the force distance curve. So remember this thing under quote which we have mentioned. As you can see that there is a probe here in this apparatus when we are seeing this in vitro biodescent test, okay, or texture analyzer we say them. So gastric mucosa is there, pig gastric mucosa is there, simulated in the simulated gastric medium it is kept, and then this this is the mucosa. Can you see here in this inset the mucosa, and this work, what is the detachment force required for the for detaching this probe from this mucosa is noted basically, as we can see here, okay. So when we are taking it upward, the probe, that force is recorded. So what are the variables in this test? Changing the value of the applied force at the contact force, then contact time, trigger force, and post test speed or withdrawal speed, for at the speed at which you are withdrawing the probe from the touch of the mucosa. So we are sticking it and taking it again back. So the work required, the workforce required, work of addition is called, we call it, that the force required, we note, and it is the indicator of the your biodesal. Now let us see the another test, modified balance. It is called modified balance or surface tensiometer. What we are doing here, the force which was needed to break the adhesive bonds was recorded. Okay. In these apparatus, whether you take this apparatus A, B, C or D, any apparatus you take, what is happening basically, the it is first in the stage 1, what we are doing that we are affixing the thing, affixing the balance or affixing with the this mucosa, and we are again seeing that what is the force required for detaching it. It is little bit different because we are checking that what is the surface tension is there. Okay, surface tension is there and how we can overcome it. So they are not standard methods, just the depending upon your requirement, depending on the availability, you can design any apparatus. As we have seen that the rubber stopper you have taken in this apparatus, if you say what is there, that the polymer is kept here and the force required we are using here. Again in this case, as you can see here, this is the place where the detachment force is being recorded here. Okay, in this index lever. And yeah, in this balance method, we are increasing the weight of fluid and we are measuring it, and the force required to detach this assembly from the this attachment, mucoadhesive attachment, we are recording it. In the same way, as you can see in the play in the number 1, the balance method, again here the chart with the help of chart recorder, the force required, that this force required to detach this probe from the mucosa is being recorded. Okay. Now in vitro biodescent test. Other biodescent tests, there may be several, but many investigators have prepared the very modified test, like say from addition weight method that we have discussed a little bit. Ion exchange resin particles may be used, and for in the case of guinea pig intestine, we can use it. Fluorescent probe, in the fluorescent probe method, we use the fluorescent probe. Conjunctival epithelial cell membrane are used in this. And flow channel method, they are thin channel made up of glass are used for the aqueous solution of bovine submaxillary mucin is used as a substrate. Other methods include falling liquid film method. In this method, what we are doing, an inclination of a Tyson tube flute is used with the substrate rat intestine. Colloidal gold staining method is one of the most commonly used method. You can say colloidal gold particles are used here. Okay, in the colloidal gold particles, the mucin molecules are the substrate here. Again, the viscometric method, natural anionic and ionic polymers are used with the 15% weight by volume porcine mucin dispersion in 0.1 SCl we use as a substrate. So what the membrane we are using, on which thing we are using, the method we can develop a good number of methods. It all depends on the availability of the things with you. There are no standard method that yes, this is the pharmacopoeia official method. No. However, texture analyzer are somewhere mentioned in some pharmacopoeias, they are mentioned as a biodescent test, but they are not still the standardized apparatus. Okay. In vitro drug permission study by different cell, we have discussed it earlier also, but we will just give you, because it is very relevant here, that they are the in vitro permission study. Basically, more than the dissolution, the diffusion, the permission is important here in the mucoadhesive drug delivery. Now we want to assess the permission across that mucosa. What we need the diffusion cells. They are smaller size apparatus with the two compartments, donor and receptor compartment, which are separated with the semi-permeable membrane. This may be a natural intestine mucosa, or the artificial membrane it may be, which is mimicking the environment of the natural membrane, and we fixed it in the between the donor and receptor compartment. Now, median, the receptor compartment is agitated on a magnetic stirrer and samples are removed at different time intervals by replacing the same amount of pre-warmed media each time. As we can see, let's see this Casey cell and French diffusion cell. So they are both are vertical type dissolution apparatus. Though, apart from them, vertical apparatus, do you remember? This is this was JL cell. If you remember, they are JL cells. Okay, JL cell. Do you remember? Java Lordy cells. They are just actually these are Java Lordy cells are just the uh, dissolution apparatus like and we are using it in the basket as I'm just drawing it for you. They are just like dissolution apparatus jar and the basket is there, so we call it Java Lordy cell. Okay. Case-rich in cell, donor and receptor compartment there, and again here in the French diffusion, they're little bit hydrodynamic. If you are maintaining any hydrodynamic and thermodynamic condition, we can prepare anything as a diffusion cell. Okay. Now horizontal diffusion cell, as we can see in VC cell and another cell, do you remember in the vertical? There are two types of diffusion cells, vertical and horizontal. Among the vertical, we have discussed one. Okay, Kesri chain, French diffusion, and Java Lordy cells. And the two major horizontal cells, Valier chain, which you are seeing here in front of you, and next one is GC cell. Remember GC cell, yeah, the GC cell you will prepare. So Ghan-Chin cell it is called. In Valier cell, there two horizontal compartments are there, as you can see here. These are the compartments. Okay, these are two half cells they are called. In between them, this is the membrane which is vertically basically placed in between two compartments, and the flow of drug and the actual instrument is seen here. It's made of glass and the clipped here. The membrane is put here. This is the membrane place as which you are seeing, which you have seen here. Okay, so uh, the movement of drug is from one half cell to another half cell. Okay, and this movement, this again the membrane, when the drug passes across this membrane, the sampling from the sampling ports, the samples can be taken and they analyzed. Okay, now this is the again the compiled version of the all the types of diffusion cells. Depending on the volume receptor cell, effective membrane area and speed, we have compiled the horizontal type and vertical type. In horizontal type, VC cell, Valier cell, GC, Ghan-Chin cell, French cell, vertical, KC vertical, and JL vertical. Okay, so in VC cell, volume of receptor cell is 3.5 ml in each half cell, while in Ghan-Chin cell it is little bit more, 140 to 250 ml in each half cell. It's a bigger one. In the France, 10 to 12 ml, KC 12 ml, Java Lordy 1000 ml as the dissolution apparatus you see in the jar capacity. Effective membrane area is 0.64, 13.9, 1.57 to 4.75, 3.14 and 12.6 for the respective cells in centimeter square. In the speed, generally all are having the 600 rpm speed is there, except in Ghan-Chin cell, which we can vary, we should vary 60 to 1000. We can vary it. However, speed can be varied in any diffusion apparatus, but in general it is kept 600 rpm. Okay, so this you must know because it is utmost important characterization parameter, that mucoadhesion, that permeability you must uh, evaluate when we are talking about the uh, when we are talking about the evaluation of the uh, mucoadhesive films or the mucoadhesive drug delivery systems. Okay, because the permeation is utmost required phenomena for the mucoadhesive drug delivery. Now, if we talk about the applications, oral mucosal drug delivery is used for the local as well as the systemic effect by the lidocaine for mouth ulcers, anti-anginal, anti-hypertensive for the systemic effects. Like for example, the triamcinolone, nitroglycerin, etc., can be used for the oral mucosal drug delivery, and there are so many uh, uh, commercial preparation are also available. Systemic delivery of insulin and other drugs which are degraded in GIT can be done with the help of mucoadhesive drug delivery, and for the oral mucosal spray of insulin is are also available. Gastromucoadhesive delivery system for drugs showing absorption window, which are having an absorption window in a particular GIT. What we can do, we can deliver them directly to the mucosal route. So it will help that they won't they will be absorbed and avoiding that absorption window, because in the absorption window once they pass through that window they won't be absorbed, so it's better to give them the maximum opportunity. Okay, site specific delivery, like in the case of nasal, rectal, vaginal, in or in local inflammation, it is utmost important. So what is the homework for you here? That you will have to enlist the commercial preparations of transmucosal drug delivery. You know what you have to do, you mucoadhesive drug system or biodhesive drug system or transmucosal, whatever you call them, uh, you will have to enlist all the commercial preparations, either in the Indian scenario or the in the global scenario. Enlist them, what is the name of the brand and what is the drug, okay, and for which therapeutic ailment it is being given. Enlist them and include it in the application part. Now, it will be very helpful from exam point of view that you must have this kind of table or the brief representation ready with you. These are some of the references of the mucoadhesive drug delivery. So Park and Robinson's, they were the pioneer for the mucoadhesive drug delivery. Their work have been very wonderful. The book, their article, their books, uh, are very good references for basically for the bioadhesive drug delivery systems. Now let me summarize this aspect for you, that what is the mucoadhesive delivery system? One, polymeric substrate or polymeric delivery system. One, once it comes into contact with the biological membrane, it is called bioadhesion or mucoadhesion. If it is a mucous layer, it is called mucoadhesion. There are two stages as we have discussed in the last lecture. They are the contact stage and consolidated stage. And the polymer characteristic is very important apart from the drug, environmental factor, physiological and pathophysiological factors. Okay. As far as the classification of mucoadhesive drug delivery system is concerned, it may be depending upon the solid, semi-solid and liquid state, or dosage form based, like in the, whether it is tablet, gel, spray, okay, or film, or it may be depending on the routes of administration, oral mucosal drug delivery system, rectal, vaginal, this or nasal. They may be depending on the routes of administration. They may also be classified. As far as the preparation is concerned, the preparation of mucoadhesive drug system are done in the by the conventional method, by which these dosage form delivery system are generally planned. Say for example, tablet will be prepared as such. The films will be prepared by the same method. Just you have to focus the drug related factors, polymer related factors, that you will use the mucoadhesive polymers, biodhesive polymers only. Okay, the techniques must involve the all the processing in such a way that the mucoadhesion and biodhesion is ensured there. The process should not affect the overall uh, impact on mucoadhesivity or the biodhesivity. The characterization of mucoadhesive drug system involves, apart from other parameters of evaluation, like the thickness, or you may say drug content, drug loading. What we need to do, we need to do the in vitro biodescent test, like the from the texture analyzer or surface tensiometer. Okay, you can do that. The force required to detach from the mucosal surface is recorded there, and it may be swelling property. Okay, swelling you can perform in the agar test, and the percent swelling or swelling index is calculated or determined. Surface morphology by the SCM, the surface morphology may indicate by the in vitro permeation studies, with the help of diffusion cells. It may be French diffusion, or Kesri chain, or Java Lordy, and in the horizontal type it may be the Valley chain cell and Ganman chain cell. So you must remember the, we have also mentioned in the transdermal drug delivery, you must remember the diagram of each and everything. We just skipped only one, that is Ganman chain cell. This is little bit bigger version of the Valley chain cell. Just note it down and learn their comparative features of all these diffusion cells. Applications we have discussed that they are used for various oral mucosal or vaginal, rectal, and nasal applications for various kind of drug for local as well as the systemic effect. So this is all with respect to the mucoadhesive drug delivery. Hope you have got all your queries answered, and we will be coming back with the next lecture in our series of lectures on the no drug system. Thanks for being with us. Happy learning.